We are all grateful for emergency medicine, which is excellent in life-threatening situations. But what about the medical treatment of disease, specifically the understanding of the cause of disease? This video series explores a precise, scientific model for understanding at a root level changes in the human organism commonly referred to as disease. This understanding makes new care strategies for a wide variety of diseases possible, for common illnesses like a sore throat, as well as chronic illness like diabetes, or even life-threatening diseases like cancer. All those interested in this topic are warmly invited to this introduction, although it is likely that a period of time will be necessary to integrate this new understanding of sickness and health into your thinking. Until now, we have not had a plausible explanation for why a particular person has a specific symptom at a specific time in their lives. We asked ourselves, why me? Why now? Why this? It was clear that symptom-based therapies were developed and administered almost independent of the personal circumstances of individual cases. By knowing the meaningful special biological programs and the first natural law of biology, we and our tumor patient now understand exactly why me, why now, why this symptom. All bodily functions adapt to external circumstances on a daily basis. For example, we sweat and our pulse rate
empezará a latir más rápido. Si nos ponemos al sol, nos pondremos morenos. Si hacemos ejercicios de musculación,
i nostri muscoli crescono se li spingiamo regolarmente al limite. Tuttavia, altri cambiamenti a livello
cellulare. Bei anderen Funktions- und Zellveränderungen spricht man dagegen von Krankheit, weil hierin bisher kein Sinn erkannt wurde.
Изучая новую медицину, мы понимаем, что ничто в организме не является неправильным или ложным, что все изменения являются частью...
השינויים אינם אלא חלק מתוכנית ביולוגית משמעותית מיוחדת של הטבע, או בראשי תיבות, טב"ם.
We are all grateful for emergency medicine, which is excellent in life-threatening situations. But what about the medical treatment of disease, specifically the understanding of the cause of disease? This video series explores a precise, scientific model for understanding at a root level changes in the human organism commonly referred to as disease. This understanding makes new care strategies for a wide variety of diseases possible, for common illnesses like a sore throat, as well as chronic illness like diabetes, or even life-threatening diseases like cancer. All those interested in this topic are warmly invited to this introduction, although it is likely that a period of time will be necessary to integrate this new understanding of sickness and health into your thinking. In this part, we begin with why a cause-based therapy in conventional medical models has so far rarely been possible. In many diseases, the cause is declared unknown, or is speculated to be, or is not fully explained. Also, viruses and bacteria are frequently blamed for an illness because they are, in many cases, present during the illness. But this explanation is just as suspect as blaming the police for causing traffic accidents just because they happen to be present at those we observe. Who is present at an accident gives little insight into who or what actually caused it. Indeed, the same germs, in the same quantities, can also be found in healthy people, if you make the effort to search for them, and then share what you find with the world. If a cause is actually identified, there still remain unanswered questions. A few short examples. With osteoarthritis, for example in the knee, an operation can often help alleviate the complaints. However, the famous experiment of the surgeon Bruce Moseley has shown that the results are identical if this surgery is deliberately faked. This is known as the placebo effect, which leads to many contradictions in conventional medicine, as how can these symptoms be alleviated by a sham operation? We have all believed since childhood to understand how cavities form. We eat sugar that gets stuck between our teeth. Bacteria feed on the sugar and produce acid. The acid attacks the enamel, leading to holes. Now, if cavities usually or always occurred in pairs, then this explanation would be plausible. But this acid is apparently unusual in that it almost always harms only one side, leaving the neighboring tooth unaffected. The following is well known. No sooner than the stress of everyday life is lifted by the weekend or a vacation, then you fall ill, a phenomenon known as leisure sickness. It is said that the immune system is weakened by stress and thus made susceptible to infection, unable to react to the arrival of bacteria and viruses. At this point in the explanation, one is curiously not sick. It's as if a horde of barbarians stormed a castle that is presently unable to defend itself, but for some reason they abstain from burning the place to the ground until the denizens can mount a defense. Blockage of major vessels is cited as the cause of heart attacks, although there are studies that show that collateral vessels compensate when blockages occur, illustrating a major difference between observation and theory in heart attacks. Large mammals have far more cells than small ones. They should thus experience more frequent malignant cell degradation in the form of tumors, since there are simply more cells that can degrade. This, however, is not the case. An observation called Peto's paradox is well known to medicine. Such contradictions can be found in a variety of disease images. Often, the description of a serious illness runs as follows. The risk of falling seriously ill to sickness X increases if you belong to a certain age group and if you smoke. One sex is more at risk than another. Those who are ill with sickness Y are twice as likely to fall ill to X. The immune system plays an important role, which is in turn influenced by nutrition, athletics, and countless other factors. Genes are further believed or declared to influence this risk. It is also speculated that data, such as your place of origin, and too much or too little exposure to the sun also influence this risk. A special virus is implicated in 90% of all cases of a specific variant of this disease. With so many suspected, but hardly controllable influence factors, it is clear why cause-based therapies have remained exceedingly rare. Instead, symptoms have been treated with great effort and many side effects. This woman, for example, has been diagnosed with breast cancer due to a tumor affecting her mammary glands. Our present society is of the opinion that a radical program consisting of surgery, radiation, and chemotherapy is necessary. In subsequent parts of this video series, we will see that step by step, new perspectives and treatment options will present themselves if consideration is given to the cause and course of the illness. Because perhaps individually verifiable, predictable, and precise laws exist that explain the cause and course, of an arbitrary disease, which can be verified by most so afflicted with little effort and that resolve the above-mentioned contradictions and ambiguities? Discover them in what follows, if you are so inclined. Imagine the following dramatic scenario. Your son is shot. After lingering in agony for months, he dies in your arms. Not long after, you are diagnosed with a malignant cancer, even though you have never before been seriously sick. Would you suspect a connection? This man was a specialist of internal medicine. He experienced a terrible blow when his son was shot, eventually succumbing after a months-long agonizing fight for his life. A few weeks later, this doctor was diagnosed with testicular cancer and successfully treated. He did not believe that he was dealing with two unrelated events. He suspected that the shock of his son's misfortune and his subsequent cancer were somehow bound, especially since his wife, who had also never been seriously sick, also developed cancer soon thereafter. Due to his work as a doctor in a Munich cancer ward, he was able to question hundreds of cancer patients who confirmed his suspicions. These hundreds led to tens of thousands of investigated cases that culminated in the discovery of 5 biological natural laws that form the basis of his new medicine. These laws provide a completely new approach to explaining the how and why of disease. In other words, how changes occur in the organism, what course they follow, and what point they serve. At first, he thought that these laws only applied to cancer. Over time, though, he realized that in fact, they causally explain the majority of diseases and symptoms, not only in people, but also in animals. Before turning to this discovery in the next few parts, it is important to first understand a little of the history of this doctor. The spread of his discovery was bound up with the death of his son from the beginning. He was shot on vacation by, of all people, the heir of a monarch, who brought all means to bear in covering up the scandal. Character assassination in the media, bribery, blackmail, death threats. Despite all of this, he feverishly researched his discovery and soon approached his physician colleagues and the university. It seemed to be a discovery of unimaginable proportions. The empathy and understanding he communicated to his patients stood in stark contrast to the disastrous manner in which he informed the outside world of his discovery, earning him many enemies. He was soon accused not only of posing a completely isolated theory, but also that he had ignored the rules of science and had furthermore made massive mistakes of form. Thus, instead of enthusiasm or interest, he earned only ridicule, rejection, and a prompt dismissal. The public review of his discovery he requested in front of a scientific committee was never granted, due to the decades of mutual misunderstanding that followed. Only on a smaller scale were there isolated confirmations of his discovery by various groups of doctors and clinics. Historically, refusing to deal with new discoveries is common when the basic assumptions of a science are called into question and a so-called paradigm shift occurs. This unchecked, violent rejection of a new discovery by the scientific elite is called the Semmelweis reflex. Ignaz Semmelweis, a 19th century Hungarian physician, surgeon, and obstetrician, challenged the medieval assumption that hygiene has no bearing on the course of disease, surgery, or childbirth. Although he scientifically clearly proved his new findings and managed to reduce the infant mortality rate of his patients from over 12% to under 2% by applying simple hygienic measures, most physicians at the time rejected his findings as nonsense. Countless thousands of people had to die before his discovery was recognized and applied. His colleagues even had him committed as a madman, where he died after only a 2-week confinement. Why this digression? Because the rejection of the discoveries presented here seemed to be just such a Semmelweis reflex. However, the extent is far more serious. The name of this doctor is Dr. Hammer. A disaster began to take shape as he was increasingly defamed in the press. In the context of this downward spiral, his medical license was revoked, he was imprisoned, he proposed more and more destructive hypotheses, he was perceived by the public as a madman and retreated into exile. This negative image of Dr. Hammer has the unfortunate consequence of branding all therapists and doctors who embrace his new medicine as crazy, even if they limit their acceptance to the 5 biological natural laws and not his other personal and private views. These terrible experiences have naturally impacted Dr. Hammer, so that it is understandable that his worldview and the way he chose to communicate it changed in ways that now make it difficult to spread his now 30-plus-year-old ingenious discovery. Even if a person is intrigued by the discovery, they often turn from the subject upon learning of Dr. Hammer's political and ideological views. These can sound conspiratorial or even crazy to many people, but irrespective of their truth, they can causally be understood by investigating his incredible life story. Besides, the laws discovered by Dr. Hammer apply regardless of who discovered them. No matter whether a discovery is made by Professor Schmitz or Sophie Meyer, whether the discoverer cheats on his wife or secretly picks her nose, all of that is irrelevant to the discovery. So the easiest way to get started is to focus exclusively on Dr. Hammer's discovery, the 5 biological natural laws of new medicine, abbreviated 5BN, which we shall subsequently explore, because everyone can verify them with a reasonable effort, whereas the other non-medical, controversial statements of Dr. Hammer are difficult to ascertain because of the ambiguities. Can you imagine that nature does not engage in nonsense? That all bodily functions are purposeful, that they follow a plan and have successfully for millions of years? All bodily functions adapt to external circumstances on a daily basis. For example, we sweat and our pulse rate climbs when we jog. Or we tan upon prolonged exposure to the sun. Or our muscles grow if we regularly push them to their limit. However, other changes at the cellular or functional level are referred to as disease, as so far nobody has been able to make any sense of them. By knowing the new medicine, we realize that nothing in the body is wrong or false, that all changes are parts of nature's meaningful biological special programs, abbreviated SBS, whose purpose is to support the survival of the individual or the pack. Special program means a program that starts under special conditions, namely when basic biological needs are suddenly no longer met, such as the intake of food or oxygen, physical integrity, contact with other living beings, status in the territory, reproduction, etc. The same biological needs are found in animals as well, even though each species has its own peculiarities derived from its biological code. Since the majority of the body and its functions are very similar in all mammals, its adaptation mechanisms, in the form of meaningful biological special programs, are largely identical. What is usually very different in humans and animals are only the situations in which a basic biological need is no longer met, which triggers a special program. Here are 3 examples, first from the animal kingdom. If a deer is surprised by a forest fire, its survival is in danger, and it reacts with fear of death. This sensation triggers the SBS, i.e., the meaningful biological special program of the lung alveoli, which are responsible for the oxygen uptake. They maximize their function within the SBS, so the deer can run faster and longer to escape the threat. The antelope finds her water hole dried up, and suddenly does not know where to find fresh water. To survive, she must leave her safe environment and starts the SBS of the kidney collection tubules. These are responsible for the reabsorption of the water. The SBS will increase their function so that almost all water will be retained until the antelope has found another safe source of water. A fox cub falls down a slope, injuring himself severely. The mother realizes that it is in acute danger and can no longer take care of itself, and that her duty to ensure the safety and care of her child is violated. An SBS of the mammary glands in the mother is activated to produce more milk and thus better care for the little one until it has recovered. Almost everything we have until now referred to as disease occurs within the framework of such a meaningful special biological program. Today we have cataloged well over 100 different such developmentally understandable programs. Developmentally understandable means that in the original natural way of life, these programs are meaningful and aid survival in difficult situations, as shown in the examples. Let us examine the same examples in a modern, unnatural way of life, typical of civilized humans. Fear of death lasts only a short time in nature. Either the animal escapes the threat or it dies. Humans, on the other hand, may experience death fright for months. For example, due to a bad medical diagnosis. The fear of death is the same as with the deer, but there is no real visible threat or enemy to flee or run away from. He now persists, perhaps months or even years, in the sensation of dread, a situation our biology has not anticipated. The SBS of the lung alveoli starts here in the person too, but they do not work for minutes at their maximum capacity, but for months. As a result, cells proliferate to better serve this seemingly perpetual task. Depending on the intensity and duration, this cell proliferation is then visible in an X-ray and will be diagnosed as alveolar cancer by a radiologist, or imprecisely as lung cancer. The loss of the safe environment, as in the example of the antelope, lasts in nature for only a short while. That is often not the case with us people. For example, when the elderly wife has died, the widowed man has to leave his house and is left alone in a retirement home. As a result, depending on the perception of the situation, the SBS, the meaningful biological special program of the kidney collection tubules, can start. Unlike the antelope who either dies or resolves the situation within a short time by finding a new safe environment, the old man stays here for the rest of his life. Since the kidneys now hardly excrete water, he is diagnosed with kidney failure. We will see why this older gentleman could react in this way while 100 others would not, or perhaps react in a completely different manner. In the wild, the duration of mammary SBS is always limited in time. Contrast that to humans, for example, when the little daughter suddenly runs into the street and gets hit by a car. The mother can start the same SBS with instinctive anxiety about her daughter to provide the child with more breast milk. Unlike the fox in the forest, however, the situation does not necessarily resolve in a few days to whether the child lives or dies. Thanks to emergency medicine, the child can be artificially kept alive for weeks, even in the worst injuries, and end up surviving such a terrible accident. But as a result, the SBS of the mammary glands runs in her mother for weeks, so that the cells, working at their maximum capacity, multiply. It forms a mammary tumor, which is also imprecisely referred to as breast cancer. But before someone worries unnecessarily now, hardly any injury or illness of their own children will lead to this SBS in individual cases. Because even here, whether a woman reacts with this SBS hinges on very specific criteria, which we will look at in the next part. The launch of an SBS should make us fundamentally capable of acting and help us to survive the difficult situation. Only if the woman, in the case of this SBS, persists for months in the feeling that the child is not adequately cared for, will the cell proliferation eventually result in a tumor discovery, as was the case in this mother. The special programs are still the best possible self-regulation of the living organism, even though the rapid development of our civilization increasingly leads to the fact that the organic changes no longer fulfill their purpose, and thus do not really contribute to a solution for the situation. Instead, in such cases, they become separate problems that we call disease. Dr. Hammer has formulated this in the fifth biological law of nature, the law of the understanding of every so-called disease as part of a meaningful, special biological program of nature, understandable in terms of evolutionary history. From the previously assumed causes, such as malignant cancer cells, pathogens, or defects, is far and wide nothing to be seen. We see only sensibly designed programs of our body, which lead, due to excessively long maturities, to functional and cellular changes, which were previously regarded as malignant, infectious, or defective. By understanding how these special programs work, hardly anybody need worry about serious diagnoses. If the tumor patient in our example knows that breast cell growth has a very concrete connection to her life, then it is no longer a chaotic malignant process that inevitably leads to an agonizing death in her imagination. Rather, it is a regulated program whose reason for being she can understand, whose further course is roughly foreseeable, and, above all, whose further course she herself can influence and affect in a positive manner, as we shall see. She is no longer a victim of the disease, but becomes an active co-designer of the further course through her knowledge of the 5 biological laws of nature. As with the pulmonary alveoli, kidney tubules, and mammary glands, each tissue in the body has its own special program, and thus its own way of adapting in the event of conflict, following a precise, reproducible, and predictable pattern which we will examine in the following sections. How does such a meaningful biological special program start? A person suddenly experiences a situation in which a basic biological need of theirs is threatened, one which is unexpected and is perceived as highly acute, dramatic, and isolating. That means they unexpectedly lose control of the situation and feel alone with the threat. The situation represents a so-called biological conflict for them, which will in turn initiate a meaningful biological special program. Whether the situation fulfills these criteria for them depends on their individual perception of the situation, which is determined by their ideas and beliefs, abilities, education, culture, social integration, the biological code of the human species or respective animal, and much more. A variety of things influence these internal frameworks, and they therefore probably also act as the interface to many other health-promoting models. Someone who keeps his body vigorous through healthy nutrition and sports, or who is always mindful and dissolves old, rigid beliefs through spiritual techniques, will be less likely to perceive threatening situations as a biological conflict, necessarily meeting all three criteria: unexpected, highly acute, dramatic, and isolating. The trigger for an SBS is thus the subjective, conflictive feeling of a situation, not what happened objectively. While one person perceives a situation as a biological conflict, the same situation can be perceived by another person as insignificant, exciting, or even funny. Take, for example, suddenly losing one's job. If the person has a good education, close friends with whom they can stay for a while if necessary, financial security from their family, as well as high self-esteem, the situation is certainly uncomfortable for them, but will probably not result in a biological conflict. If, on the other hand, they are financially dependent on work, they have no family to help them out, little education, making them anxious applying for jobs, then they are in a position to meet the unexpected, highly acute, dramatic, and isolating criteria. This situation for them is much more likely to be perceived as a biological conflict. Or take the example of the elderly man who has gone into a retirement home because of his wife's passing. Let's say he lived for 60 years in the same house that he personally built. His wife had cooked for him, and he has always had difficulty connecting with other people. Having to move to a retirement home can therefore easily be perceived as a loss of his safe environment, or as an existential fear. For others, the conditions may be completely different. One has changed apartments every 10 years and makes new friends easily. Another can provide for himself and the grandkids live very close to the retirement home. A third has been preparing for this situation for years and has already chosen a facility for himself with especially loving caregivers. Therefore, there are no biological conflicts for any of them. It is therefore impossible to judge from the outside whether a situation will lead to an SBS for a particular person, since every person is unique and has very specific internal and external framework conditions. Bypassing the conscious mind, these factors determine whether a situation is instinctively perceived as a biological conflict and which special program is then started. But conversely, one can always be sure that each SBS must have been preceded by a very specific conflicting situation, even if the situation itself is highly individual. Each biological conflict deals with a certain kind of threat or instinctive feeling, depending on which basic biological need is threatened. This is called conflict content and determines which SBS is started to solve the conflict, always synchronously on 3 levels: psyche, brain, and organ. In the psyche, there will be compulsive thinking about the problem in order to find a solution as quickly as possible. We can barely sleep and have a hard time concentrating on other things. Changes in the brain can be objectively assessed using medical imaging techniques. Dr. Hammer made extensive use of this possibility in his research. Once he found that all persons with similar organ activity also show visible changes in identical locations in their brains. In the context of each more intense SBS, a concentric pattern centered on the associated brain relay is visible on the sectional planes of CT images, a phenomenon known as a Hammer focus. Depending on the tissue type, there is an increase or decrease in the function of the associated organ, which leads to cell proliferation or cell loss, given unbiologically long conflict times. There is always a logical connection between each tissue and its conflict content. The bladder mucosa, for example, is sensitive and tells us how full the bladder is. This enables urination. In the animal kingdom, to mark one's territory. The content of the conflict, therefore, is that you are unsure where your own territory or its boundaries are, or where you can mark, so that it is recognized and respected. The territory can be, for example, the apartment, the partner, the workplace, a club, a car, etc. The voluntary muscles serve to perform vital physical tasks. The conflict content of muscle tissue is therefore about not being strong enough to perform a motion. The sensation here is failure. That is, for example, a narrowly missed goal that was perceived as important because the strength was insufficient. At the psychic level of the SBS, timeline changes are visible immediately after the biological conflict. By contrast, at the organic level, it may take weeks or even months for the functional changes to become problematic cellular changes, which lead to increased symptoms. This time lag led to the idea of the psyche as the cause of disease, as one can often observe how a person with an altered mental state eventually develops severe physical symptoms. There is, in fact, a connection between the psyche and the organ. However, the change in the psyche is not the trigger of the organ changes. Both are parallel symptom levels of one special program that was started by a biological, instinctively perceived conflict. Ideas such as stress or bad thoughts lead to illness are therefore incorrect and may lead to focusing efforts on combating mental symptoms even though they are but part of the adjustment mechanism whose purpose is to bring about a quick and effective solution to the conflict. Thinking away the problem is therefore not possible. The synchrony of the 3 levels, psyche, brain, and organ, enabled Dr. Hammer to precisely research this model and is an important foundation for the science of new medicine because if 1,000 patients experience a growing tumor of the liver cells, one must also find a Hammer focus in the brainstem of those same 1,000 patients, centered on the control center for the liver, as well as a psychological feeling and behavior of starvation in each of them, since at its root we are dealing here with a so-called starvation conflict. Correspondingly, you will find a liver tumor in every patient showing a Hammer focus in their liver control center, and their thoughts will be preoccupied with starvation anxiety. Theoretically, you should also be able to deduce the other 2 levels from the psyche. However, since the psyche is not measurable, such conclusions are extremely error-prone and therefore of little relevance. All this is encapsulated in the first biological natural law, which summarizes the following 3 criteria. Each meaningful biological special program is activated by an isolating, dramatically felt circumstance. This activation is not psychic in its nature. The nature of the unconscious sensation of the biological problem determines which specific, meaningful biological special program, SBS, is activated. The SBS always runs simultaneously on the 3 levels: psyche, brain, and organ. Until now, we have not had a plausible explanation for why a particular person has a specific symptom at a specific time in their lives. We asked ourselves, why me? Why now? Why this? It was clear that symptom-based therapies were developed and administered almost independent of the personal circumstances of individual cases. By knowing the meaningful special biological programs and the first natural law of biology, we and our tumor patient now understand exactly why me, why now, why this symptom. There are still some open questions, such as the sidedness of the symptoms, that is, left or right side. These will be explained elsewhere. Up to this point, however, the tumor patient does not yet know whether there are new, more targeted ways of dealing with the symptoms so that they can recover as quickly as possible. Concrete first approaches to this are provided by knowledge of the way an SBS unfolds, which will be discussed in the next part. If symptoms occur as part of a meaningful biological special program, is their course also meaningful? Do they follow a plan? As Dr. Hammer writes in the second biological natural law, the law of the 2 phases of all meaningful biological special programs, provided there is a resolution of the conflict. In the normal day-night rhythm, the organism switches between active and rest modes. A so-called conflict-active phase initiates the reaction to a biological conflict. The organism switches into alarm mode, no matter what time of day or night, to create the optimal conditions to overcome the conflicting situation as quickly as possible. So, you are mostly awake, full of energy, and zest for action. As we have already seen, the consequences on the 3 levels of SBS are compulsive thinking of the psyche, a symptomless characteristic Hammer focus in the brain, as well as functional changes in the organ. Our tumor patient, whose daughter was hit by a car, will therefore constantly obsess about her child and how she can help her. At the brain level, there is a Hammer focus on the side of the cerebellum. At the organic level, 1 or more mammary glands will increase their function. Let's say the child is very badly hurt, is now in mortal danger for weeks, and recovers only after a few months. The mother will constantly be in acute concern for her daughter and remain in a conflict-active state. Her mammary glands will work for months at their maximum capacity. But that does not resolve the situation, as in the example of the fox mother, and as anticipated by our biology. Now the cells begin to proliferate in a long-lasting conflict-active phase to better meet the heightened demands. The resulting mass is called a tumor. The longer the conflict-active phase lasts, the bigger the tumor will get. The reason that a particular breast gland or group of breast glands within the breast is engaged with the SBS and not all of them is still unclear. Consider the evidence in reference to. We are therefore not dealing with degenerate cells that seek to harm the body, but a biological adaptation process which does not lead to the desired solution. Also, not all tissues react with cell proliferation as an adaptation in the conflict-active phase. There is also the possibility of cell loss, as we will see in the next part. The conflict-active phase ends with conflict resolution, when the causal threat is gone and the SBS loses its reason for being. Now starts the second phase, the so-called conflict-resolved phase. On a psychological level, we are relaxed, happy, or even euphoric, as the stressful situation is now a thing of the past. At the brain level, there is a swelling in the associated Hammer focus, which, depending on its size, can lead to various brain symptoms such as certain types of headaches, nausea, or temporary loss of function. At the organ level, the adjustments and changes in the conflict-active phase are now reversed, which is often associated with inflammatory symptoms. For example, when excess tissue is broken down or new tissue is regenerated. Much of everyday illnesses, such as colds, coughs, or sore throats, are usually diagnosed at this stage, as we feel sick, have a fever, we are weak, and need to regenerate. Towards the end of the process, scars and other residual states form. In our example, the conflict may only resolve once the daughter is out of danger. The mother is now generally exhausted, but mentally relaxed. The Hammer focus swells strongly at the beginning of the conflict-resolved phase and can cause problems with its space requirement. The organic changes are also reversed in the breast if the tumor has not already been surgically removed. The body decomposes the surplus tissue with the help of microbes, forming pus as a metabolic end product. If the duration of the conflict-active phase was unbiologically long, as in our example, the extent of the formation of pus can be very large and lead to problems of its own. After complete degradation, scar tissue remains behind, which can also be problematic in many ways depending on its size. The duration and intensity of the conflict-active phase roughly corresponds to the duration and intensity of the conflict-resolved phase and determines the extent of the expected symptoms, which makes it possible to estimate symptom progressions. In the middle of the conflict-resolved phase, but no later than 3 weeks, there is a particular interruption, the so-called epileptoid crisis, EC. Just before that occurs, the amount of tissue swelling and the other symptoms peak. After the crisis, the swelling recedes, becomes scarred, and symptoms gradually weaken. The epileptoid crisis is thus a turning point at which the organism switches again for a short time into the active mode. Depending on the organ, this takes a few seconds to a few hours. In most special programs, this crisis goes unnoticed. In a few cases, however, there may be particularly strong and sometimes even fatal symptoms, which result in diagnoses such as epileptic seizure, heart attack, or asthma attack. Up until now, we have looked at the simple, singular progression, which is more of an exception for humans. With us, the multiple activation of a meaningful biological special program is a frequent and big problem. Since modern humans generally ignore our instincts and even our life skills hardly allow for flexibility and adaptation, an SBS often runs in an infinite loop. That is, we activate, resolve, repeatedly for years on end. For example, when we experience a biological conflict at work with an employee, boss, customer, etc., triggering an SBS, an escape into resolution on the weekend or on vacation. Most chronic illnesses are based on this mechanism, which theoretically can plague one's entire life if the living conditions or the personal interaction with them does not change. In such cases, predicting the duration of the conflict resolved phase is difficult or even impossible if the SBS is constantly reactivated. Of what use is the knowledge of the two-phase nature of the meaningful biological special programs? So far, we have often long ignored our instincts, resulting in long conflict active phases and thus strong symptoms. Now, with this new knowledge, we can, for example, identify compulsive thought as a psychic level clue of the presence of an SBS, well before we become aware of any ongoing special program through physical changes. We could then plan targeted actions or strategies that will make a quick resolution of the conflict likely, so that the SBS can be completed in less time and thus be less problematic. On the other hand, a stronger symptom can now be considered differentiated and, depending on the phase, different target-oriented therapy strategies can be selected. Let's take a look at different possibilities for our tumor patient. It could be that she is ignorant of the 5 biological natural laws, and therefore has no knowledge of the cause of her symptoms, as well as the current stage of her SBS. Even conventional medicine has no knowledge of this, and in most cases recommends chemotherapy, radiation, and a radical operation, since a tumor that enters remission without intervention is not possible in this model. Suffering for months on end, disfigurement, and often a premature death are the results. In the best case, breast-conserving surgery can be performed here, but the psychologically stressful fear of relapses and metastases remain, just as it does with anti-hormone therapy. That a person weathers this process without fears or is even strengthened does happen, but it is extremely rare. It could also be that the tumor patient has reviewed the 5BN so that she does not suffer any otherwise typical diagnostic shock, and instead an individual differentiated consideration of her situation is possible, such as Possibility 1. The SBS is in the conflict active phase. The tumor is still very small and does not grow any further, as she anticipates that her daughter will be discharged any day. Once this happens, the SBS will resolve and microbes will help to completely dismantle the tumor. In this case, no therapy is necessary. Only local, symptomatic measures should be discussed with the therapist, and the proper course of the conflict-resolved phase should be controlled. For this purpose, a variety of conventional and alternative medical procedures can be used, which can be applied even more effectively with knowledge of the 5BN. With this insight, the mystery of why a particular method helps in one case but not in another is finally understood. The result is a complete regeneration, possibly with minimal scars. Possibility 2. The SBS is also in conflict active phase. The tumor is still very small, but is expected to continue to grow since her perception is that her daughter is not well cared for in this hospital. The therapy consists here, first of all, in quickly resolving her conflict, or at least in reducing its intensity. For example, by transferring the child to another hospital, one where the mother is comfortable with her daughter's care. This reduces the intensity of the special program so that the growth of the tumor stagnates until the conflict is resolved. Here, as in the previous case, no therapy is necessary, only the control of the SBS's course. Possibility 3. The SBS is also in the conflict active phase. The tumor is already very large, and further growth is expected as her daughter's situation is unstable. Breast-preserving surgery should be performed here, as serious pus formation, bursting of the breast, and other dangerous symptoms can be expected once the conflict resolves. These, in turn, are more likely to lead to new, intensive biological conflicts, and thus to considerable, incalculable complications. An operation prevents this. However, the woman now does not need to be afraid of relapses, metastases, or other horrible health threats, and ought therefore to be psychologically relaxed about her own health. Possibility 4. The SBS is in the conflict resolved phase. The tumor is already degrading with the help of microbes, which has led to pus discharge, which causes the mother to visit her doctor. The diagnosis does not cause her to panic because she knows the connection to her life. Her daughter has recently recovered and has returned home, which is the reason the SBS has resolved. In this case as well, no therapy is necessary, only a check of the proper course of the SBS. There are, of course, thousands of other possibilities that the SBS course may take in individual cases. But by knowing the 5BN, the patient, in almost all cases, has plenty of opportunity to positively influence this course and emerge smiling. Of course, all this being said, the 5 biological laws of nature offer no promise of salvation or the like. Again, sometimes surgery or medication is needed, and complications or worse may occur, especially because our healthcare system does not yet recognize the 5BN, and as a result, patients are torn between different worldviews as part of their therapy, which leads to considerable problems. Taking into account this situation, however, the biological laws offer the opportunity to understand one's own biology and symptoms causally, and through them to derive meaningful therapy options. So in this example, the greatest possible health success is achieved with the least possible effort. Always, in this example, without chemo and radiation, and in many cases, even without surgery, leveraging instead targeted changes in living conditions, which subsequent accounts of first-hand experiences will allow us to more clearly explore. Even if the objective criteria were pushed to the foreground in these examples, in reality, the concrete treatment possibilities must always take into account personal individual framework conditions, as these led to the start of the SBS, but also contain the necessary options to resolve the conflict or to guide the controlled passage of the SBS. With the knowledge of the first and second biological laws of nature, we can now precisely recognize the cause, the course, and the rhythm of an SBS. But how do we know which symptoms occur in the conflict active phase and in the conflict resolve phase? This essential knowledge is provided by the third natural law of biology, which we will examine in the following section. Surely there is not a simple logical system that underlies the huge variety of illnesses and symptoms, or is there? In fact, there is such a system at the level of tissue types, for the understanding of which the knowledge of the 3 embryonic germ layers is an important prerequisite. Embryonic germ layers are the first differentiating cell layers of precursors of an embryo, from which develop the organ systems and finally the complete organs. These germ layers are therefore the basic tissue types of the human body. Each tissue thus comes from one of the 3 germ layers: endoderm, mesoderm, or ectoderm. The mesoderm is then divided once more into old mesoderm and new mesoderm. In the first part of pregnancy, the endoderm forms all the tissues for later ingesting food and oxygen, excreting, reproducing, and rudimentary perception of the environment in terms of danger or food. These include the majority of the digestive tract, the lung alveoli, the middle ear, the primal socket that will later form further parts of the eye, the prostate gland, the uterine lining, and various other tissues. The associated control centers of these tissues are located in the oldest part of the brain, the so-called brainstem. Let's take a look at the old mesoderm next. All tissues resulting therefrom have protection and supply functions, including, for example, various protective tissues such as the dermis, pericardium, pleura, and peritoneum, nerve sheaths, and sebaceous sweat and mammary glands. These tissues are controlled by the cerebellum. The new mesoderm develops into the tissues of the entire supporting and attachment apparatus, providing stability, flexibility, power, and performance. These include all bones, voluntary muscles, tendons and ligaments, the dentin of the teeth, and the blood and lymphatic system. The cerebral pith, also known as the cerebral medulla or cerebral white matter, i.e., the inner area of the cerebrum, controls these tissues. The tissues that develop from the ectoderm are important for the contact with the outer world and for the interaction and hierarchy formation with other living beings of the same species. These include the epidermis, the nerves, the enamel, various mucous membranes, a large part of the sensory organs, and the regulation of sex hormones. All of these tissues and functions are under the control of the cerebral cortex. Why this lengthy excursion to the embryonic germ layers and the early development of the child in the womb? Because all tissues of one germ layer behave the same within their respective SBS. There are two ways in which individual tissues can basically adapt to a situation perceived as conflictive. Possibility 1. The function of a tissue is first increased in the conflict active phase. In the salivary glands, for example, an increase in function naturally produces more saliva. After resolution of the conflict, the function is then reduced again, so that by the end of the SBS, the normal tissue function is restored. Possibility 2. Here, the function of a tissue in the conflict active phase is first reduced, and then increased again after the conflict has been resolved. At the epidermis, for example, this results in less sensitivity or even numbness due to the reduction in function. As with the first possibility, the normalization of the tissue function ensues. The adaptation behavior of the two possibilities is therefore exactly opposite. All tissue belonging to the endoderm or old mesoderm belong to the first group. All tissues belonging to the new mesoderm or ectoderm belong to the second group. Let's take a look at the skin as an example. It consists of several layers and also appendages such as hair, sweat, and sebaceous glands, each of which originate from a specific embryonic germ layer, so that their behavior is predetermined by the two-phase nature of their SBS. So, one biological conflict and one SBS of the skin per se don't exist. You have to pinpoint the tissue experiencing the symptom. Let's take a look at the outer skin, the so-called epidermis. One of its tasks is the feeling of closeness and contact because of its high sensitivity. If, for example, an infant is separated from its mother in the wild, it could easily turn into food for a predator. So, sensing contact is stored in its biological code as vital for survival. The conflict content of the epidermis is therefore the contact separation, or even if there is unwanted or wrong contact. If a newborn is suddenly separated from his mother in the clinic, it can easily be perceived as a biological conflict with a break in contact with the mother as a conflict content. In the baby, the SBS of the epidermis starts parallel on the psyche, brain, and organ levels. In the conflict active phase, the epidermis becomes numb, dry, and brittle due to the reduction of function with subsequent cell depletion. After a while, if the conflict resolves, after rest and confidence has been restored, the epidermis will increase in function and increase in cell count, making it hypersensitive, inflamed, reddened, and painful for the predetermined duration of the conflict resolved phase, which will then end with itching. Only the rhythm, the intensity, and the duration of the SBS decide whether the conventional medical diagnosis, without the knowledge of the 5 biological laws, is hyperesthesia, eczema, dermatitis, neurodermatitis, etc. That the current birth situation is often very conflictive for mothers, fathers, and babies explains the frequent occurrence of strong symptoms in the early days after childbirth. Many women who have gained experience with the 5 biological laws or have intuitively recognized today's birthing practices as problematic make their pregnancies and births significantly different than was previously the case. Returning to our introductory example, the kidney collection tubules belong to the endoderm, i.e., in the context of an SBS, they react with increased function and cell proliferation, which leads to an increased reabsorption of water. After conflict resolution, there is always a function reduction and cell removal until normalization. The mammary glands belong to the old mesoderm. That is, in the context of an SBS, they react with functional enhancement and cell proliferation. And so after conflict resolution, with hypofunction and cell decay until normalization. Until now, the knowledge of the germ layers and tissue affiliations was missing from the tumor patient in our example to determine SBS phase based on symptoms. Based on simple function enhancement with cell proliferation and function reduction with cell removal, almost all physical changes can be explained and understood. Be it a jaundice due to bilirubin backlog because the ectodermal bile duct is swollen due to the process that enables cell proliferation in the conflict-resolved phase, or hair loss due to reduced function of the ectodermal hair follicles in the conflict-active phase, or bone loss due to reduced function of the new mesodermal bone in the conflict-active phase, or melanoma due to functional enhancement of the dermis in the conflict-active phase, or a purulent pimple due to cell degradation in the sebaceous gland in the conflict-resolved phase, or a gut polyp due to cell proliferation of the intestinal mucosa in the conflict-active phase, etc., etc. By knowing the tissue affiliation to the embryonic germ layer and their behavior in the context of the biphasic nature of the SBS, Dr. Hammer has shown in the 3rd biological law of nature that every physical symptom can be broken down exactly if the symptoms have been accurately ascertained. And so, the triggering situation in the life of the person can be found and examined. If a person has, for example, conjunctivitis, we know, or may look up, that this belongs to the ectoderm. As a result, we know that the SBS is in the conflict-resolved phase, because that is when the previous cell decrease is reversed, which results in swelling and inflammation symptoms. So it is quite certain that she must have resolved a conflict with the content of the conjunctiva shortly before, which can be determined relatively precisely through questioning. The content of the conflict is about losing sight of something important. For example, because at the crucial moment you closed your eyes, fell asleep, or looked away. As always, when asking for conflict content, one has to find different formulations that are understandable for each person. Now you may be wondering, okay, so now what? On the one hand, that sounds quite plausible, but do I now believe in the 5 biological laws of nature, or rather in established medicine with its thousands of doctors, billions of research funds, professors, textbooks, and studies? In the next part, we will see how you have the opportunity to check the laws themselves and what else is needed. Then this question of belief vanishes, because then you can test yourself, experience, and therefore know. This is all well and good, but should I believe in the 5 biological laws of nature, or rather in the established medicine with its thousands of doctors, billions in research funds, professors, textbooks, and studies? In this last part, we look at diverse possibilities for vetting the 5 biological natural laws. Completing the series, we dig deeper into this theme to show how it might continue to progress. Previously, a patient of conventional medicine had no chance to check their own condition against medical theory, as it seemed to consist of the invisible or the random, viruses, bacteria, genes, nothing that we could test for ourselves without formal research and large-scale studies. You could, of course, hug someone suffering from an infectious disease, touch athlete's foot fungus with your hand, or refrain from brushing your teeth for years, or even parade about in winter dressed only in shorts and a t-shirt. But even then, not falling ill would hardly refute mainstream theories, as there are so many of them. The new medicine, however, offers many ways for you to verify its claims, after you are up to speed, of course, while simultaneously identifying serious advantages over the conventional medical model. Allergies often took a lifetime to deal with or required lengthy desensitization processes. Now, allergies can usually be resolved from one moment to the next if they are specifically triggered and the underlying conflict is found. We have often been surprised by irregular recurring symptoms and reacted with anxiety, and by taking medications in response to a perceived chaotic process, a defect, or microscopic enemies. These symptoms can now be accurately predicted to the day or even the hour once the underlying biological conflict has been identified. The recurring symptoms can then often be completely eliminated. Previously, it was believed that it was more or less luck whether you fell ill or stayed healthy. A specific symptom prediction was impossible. Now, the symptoms of the conflict resolved phase and the epicrisis can be predicted by identifying a particular behavior or symptoms of a conflict active phase in oneself or others. Previously, particularly strong, sudden symptoms were regarded as misfortune, as really bad luck that required the help of a doctor, who, through drugs and other measures, would restore your health. Now, with certain symptoms that occur within the conflict resolve phase, one can compare whether the associated specific conflict was previously present and resolved shortly before the onset of those symptoms. By monitoring the simple course of the Meaningful Biological Special Program, the duration of symptoms can be predicted without the need for medication or help from other people. Naturally, one can always alleviate symptoms with medications or other home remedies until the SBS is completed. However, understand that the drugs cure nothing, nor do they fight any enemies, but merely alleviate or slow down the symptoms of a repair or recovery process. Previously, it was simply coincidence if a symptom appeared on the left, right, or both sides of the body. Now you can check the side of each symptom and even possibly predict it, since the 5BN definitively states whether a symptom will occur on the left or right side. See reference 6 for the rules of the sidedness. There is little significance in naming the associated conflict with everyday mild symptoms, such as a cold or a cough, as you will probably find several matching potential conflict shock events. The symptom has to stand apart strongly from all the others, by kind or intensity. The stronger or more specific the symptom, the more meaningful the verification. We can look at real examples of all these possibilities in the following practice parts, which, with knowledge of the 5BN, show possible approaches to dealing with a variety of symptoms, and thus provide a good start to your own journey of discovery. Naturally, in new medicine as well, there are things that not everyone can easily test, simply because they do not have the right disease or lack the technical data, such as a brain CT. But it is enough to be absolutely sure over time that the underlying model is largely correct, even if certain details are not personally verifiable, may still be wrong, or not yet discovered. Of course, it is helpful to engage with others to build a shared history of experience over time. You have now received in about an hour a first rough overview of the new medicine and the 5 biological laws of nature. Of course, many questions will have arisen that are still unanswered, and more depth is needed to be able to conduct a sound review. So some things have been simplified, and other topics from the point of view of the 5BN not yet addressed, such as the influence of handedness on the body side of the symptoms, various psychoses, consequential conflicts versus metastasis theory, contagion belief in vaccinations, the 4th biological natural law of the role of fungi, bacteria, and viruses, the tracks in the moment of conflict, the outer and inner skin scheme in the ectoderm, the detailed behavior of the tissue types in the context of the biphasicity, interaction of concurrent special programs, the scale rules in the territorial areas, the various special programs in detail, drug effects on the SBS course, the 6 qualities of the endoderm, and the brain level with the Hammer foci. With a firm handle on the basics, many exciting topics stand ready to explore, such as the skin, pain, heart, fertility and unfulfilled desire for children, pregnancy and childbirth, obesity, blood pressure, depression, sensory organs, digestion, kidney, menstruation, and much, much more. For all of these topics, I refer you to other sources to deepen your newly acquired basic knowledge. One final note. Depending on the literature, different names are often used for the phases and prominent points of the 2 phases of an SBS. Instead of biological conflict, Dirk-Hammer syndrome, DHS, or conflict shock are also used. Instead of conflict active phase, the short form CA phase, active or stress phase, is also used. Instead of conflict resolved phase, PCL phase is commonly seen, where PCLA identifies the area before the epileptoid crisis and PCLB the area thereafter. There are also terms used such as repair phase or, quite misleadingly, healing phase, which is a holdover from the previous concept of disease, but is an incorrect term. The epileptoid crisis is also referred to as epicrisis for short and abbreviated to EC. So nothing stands in the way of further research. Thank you for listening and for your interest in this topic. In this practical part of the video series, Disease is Different, we take a closer look at the topic of allergies, which in fact have nothing to do with improper diet, immune system stress, or heredity, and whose causal understanding enables immediate resolution. Our real case history example, an allergy to black pepper. Ms. S. had a pepper allergy dating back more than 40 years to her days as a student. Whenever black pepper was in the food, diarrhea forced her to run to the bathroom. After understanding what might be the reason for her body's reaction, she was able to use a simple experiment to find out if this assumption was correct, and thus immediately resolve the allergy with a simple act. Do you want to understand the cause of allergies and how you get them? Perhaps you would like to search for the cause of your own allergy in order to subsequently resolve it. If so, I would like to invite you to watch the freely available 1-hour video series, Disease is Different, at www.disease-is-different.com to get the necessary basic understanding of this completely different approach to disease and health. Afterwards, you can watch this practical part in full length, as this video is, of course, only a small preview to instill curiosity about this approach. Enjoy! In this practical part of the video series, Disease is Different, we look at the exciting possibility of predicting unprecedented symptoms, which is impossible with the conventional medical model. Our real case history example, the prediction of a single epileptic seizure. The father of a 1-year-old boy, L, identified a certain behavior in his son, which occurred as a result of an emotionally dramatic situation, with the feeling being unable to perform a movement. Knowing the causal correlations, he knew that as a result of this situation, his son had started a meaningful adaptation mechanism. This adaptation program results in a cramping of the muscles at a very specific, predictable time, which is called an epileptic seizure. As a result, he was able to predict weeks in advance that his son would soon experience a single seizure. Would you like to know if that actually happened? Do you want to understand how epileptic seizures are caused? Would you perhaps want to search for the cause of your own convulsions to develop strategies to cure or overcome this disease on this basis? If so, I would like to invite you to watch the freely available 1-hour video series, Disease is Different, at www.disease-is-different.com to get the necessary basic understanding of this completely different approach to disease and health. Afterwards, you can watch this practical part in full length, as this video is, of course, only a small preview to instill curiosity about this approach. Enjoy! In this practical part of the video series, Disease is Different, we look at the possibility of understanding previous illnesses in your life from a completely different causal point of view. Our real case history example, neurodermatitis and eczema. Since her childhood, Ms. E had recurrent, unpleasant, painful, and itchy skin redness with various diagnoses, such as eczema, neurodermatitis, allergy to wool, dyes, chlorine, sun. Shortly after her 33rd birthday, she got a very severe rash in the course of a single day. Also, the symptoms were very widespread this time and included the inside of her arms and legs and, for the very first time, her abdominal region. According to this model, something very specific must have happened shortly before the onset of symptoms. Do you want to know what that was and what causes diseases of the epidermis, such as neurodermatitis? Perhaps you want to search for the cause of your own skin symptoms by yourself in order to develop strategies for healing or overcoming this disease on this basis. If so, I would like to invite you to watch the freely available 1-hour video series, Disease is Different, at www.disease-is-different.com to get the necessary basic understanding of this completely different approach to disease and health. Afterwards, you can watch this practical part in full length, as this video is, of course, only a small preview to instill curiosity about this approach. Enjoy! In this practical part of the video series, Disease is Different, we look at the possibility of understanding previous illnesses in your life from a completely different causal point of view. Our real case history example? Chronic tendinitis, or RSI syndrome. In his early 20s, Mr. M's tendons and ligaments of his right elbow suddenly began to hurt for weeks at a time for no apparent reason. A symptom which, to that point in his life, was unique. Mr. M had been participating in sports for years, playing music and slaving over a computer. Therefore, overloading was blamed as caused by conventional medicine. However, his work and stress did not change in any way before the onset of pain. They started just like that, out of nowhere. Nevertheless, here we do not look at the classical point of view, but look at the cause from a completely different, new perspective, by which a very specific event must have been experienced just before the onset of pain. Would you like to know what this was and why it resulted in 3 years of chronic suffering? Would you like to know what mechanism is generally behind chronic or acute pain in the musculoskeletal system and perhaps track down your own symptoms? If so, I would like to invite you to watch the freely available 1-hour video series Disease is Different at www.disease-is-different.com to get the necessary basic understanding of this completely different approach to disease and health. Afterwards, you can watch this practical part in full length, as this video is, of course, only a small preview to instill curiosity about this approach. Enjoy! In this practical part of the video series, Disease is Different, we look at the exciting possibility of predicting symptoms, which makes it possible to accurately and individually validate the underlying model, which is impossible with the conventional medical model. Our case history example? Back pain and lumbago, predicted years in advance. Mr. M had been dealing with this new point of view on illness and health for many years, and therefore came to the following conclusion. If I ever manage to reach the black belt in a martial art, I will have back pain for the next 3 weeks, starting the next day, and possibly get lumbago. Would you like to know how he came to this prediction and whether it came true? Would you like to know how he managed to escape this cycle of his years of chronic back pain? If so, I would like to invite you to watch the freely available 1-hour video series, Disease is Different, at www.disease-is-different.com to get the necessary basic understanding of this completely different approach to disease and health. Afterwards, you can watch this practical part in full length, as this video is, of course, only a small preview to instill curiosity about this approach. Enjoy!